Making the most of your prenatal visits is important to make sure you receive the information and care you need to best protect you and your baby. There are many ways to empower yourself in these situations and be more likely to get what you need. We will go through a sample of ways you can get the most out of appointments through tips for talking with your pregnancy care provider. At Emory Center for Maternal Substance Abuse and Child Development, we encourage all women who are pregnant or thinking of becoming pregnant to talk to their doctor about substance use during pregnancy. As part of our 2021 campaign, Keep Your Provider in the Know about drug use during pregnancy, we are providing tips on talking with your provider. The first tip is to pick a provider that you feel comfortable talking with. You should be able to ask your provider anything you'd like to know about their experience and philosophy around pregnancy and childbirth. Finding the right healthcare provider for you is essential because doctors, physician's assistants, nurse practitioners, and midwives are people just like you and me. They come with a wide range of personalities and styles of care. Sometimes they will match your own and sometimes they won't. You want to be sure that the people that you entrust with your health and your baby's health are going to help you make the right decisions about your care. Plus, it is worth thinking about how you can reduce any stress you may have about sitting down with the person who will care for you and be the source of support during your pregnancy. You can even ask to make a non-clinical appointment to sit down with her or him and discuss this if you'd like to. A successful experience means finding a provider who listens to you, makes you feel comfortable, and discusses all of your concerns and options openly and respectfully. If for any reason you do not feel like your healthcare provider listens to you or is able to create a welcoming, safe environment, change providers. If it's a requirement of your insurance, get a list of providers in your network. Then ask friends or family if they have someone they'd recommend. You can further whittle down your list by other things that may be important to you, such as male versus female provider or office location. Pregnancy is such an important time in a woman's life, so it's critical that you are under the care of a health provider that you trust. Depending on where you live and what insurance you have, it may not be possible to find another provider. But if you are able and want to, the sooner you do so in your pregnancy, the better. You deserve to feel comfortable and cared for. The next tip is to write out any questions you want to ask before your visit. In order to feel comfortable doing so, here is some suggestions. Be prepared for a short visit with the provider at regular appointments throughout your pregnancy. Write down your most important questions and make sure to ask them first. If you'd like to research some topics before your visit, choose your sources wisely. There are reputable organizations from whom you can get evidence-based information about pregnancy. Pull information from your sources and bring it with you to your appointment to drive your conversation with your healthcare provider. Bring a trusted family member or friend who can bring up anything you forget to, or that can step into the conversation to help make sure you are being heard correctly. This is particularly important at the first visit or when you are worried about something. Ask questions about the hospital at which you will be delivering. Do they have any specific policies or practices you would want to know about in advance? Your healthcare provider will be connected to a specific hospital. If you do not want to deliver at that hospital and your insurance allows for the other options, you may need to find another prenatal care provider. It is best to ask these questions before you become pregnant or as soon as you start your prenatal care visits. The third tip is to be open and honest. Anything you share with your doctor is confidential. Being open and honest about your habits will help your doctor make sure you have the best care. Tell your provider about any medications you are routinely taking. Bring them up as soon as you find out that you are pregnant, and when possible, even before you become pregnant. This will allow you and your healthcare provider to talk about whether there are any alternative medications or therapies better suited for pregnancy and/or breastfeeding. Do not stop taking any prescriptions without talking to your provider first, and always make sure that any provider who is prescribing you with medication knows that you are pregnant. If you see a specialist for other medical conditions such as asthma, diabetes, arthritis, lupus, psoriasis, etc., Tell your pregnancy provider who you are seeing and authorize them to communicate with one another about your care. When you are living with a chronic health condition, connecting your pregnancy care provider with your other health providers is important to ensure your disease is well managed throughout your pregnancy and when you are breastfeeding. Even if they don't ask you about it, tell your healthcare provider about your use of alcohol and tobacco or any recreational drugs like marijuana, heroin, or meth. Some of these substances can affect your pregnancy or your baby's development, so it's important for you and your provider to talk about it, even if you are just an occasional user. Importantly, talk to your healthcare provider if you need help quitting any of these substances. There are ways to treat substance use disorders during pregnancy. You also have a chance of being screened for substances at birth, meaning they may test both you and your baby at the hospital. Being prepared for this is important so you know what to expect. For more information about talking to your provider and about substance use in pregnancy, please visit the following resources: the Center for Maternal Substance Abuse and Child Development at Emory University's School of Medicine, Mother to Baby, the American College of Obstetricians and Gynecologists, as well as the Centers for Disease Control and Prevention and the Food and Drug Administration's resources related to pregnancy. This message is brought to you by the Center for Maternal Substance Abuse and Child Development with the support of the Georgia Department of Behavioral Health and Developmental Disabilities. The Center for MSACD's prevention program focuses on the prevention of prenatal exposures and the negative consequences of maternal substance use and/or abuse by providing a range of prevention services to agencies, communities, and families across the state of Georgia. We offer trainings, workshops, free materials, and other informational services concerning prenatal exposure to alcohol and nicotine, illicit drugs, and prescription drugs. For more information, please visit our website at msacd.emory.edu.